Hello, how are you?
I'm good. Yeah, really good, actually.
Good.
Wow, you guys are right on time. What's the temperature in Spain? You're in Madrid, right?
Yes.
Yeah, what's your temperature today?
I don't know. Today is rainy, but it's about 30 degrees these days.
Okay, well, we're hotter than that today.
Yes.
And our
Yeah, it's starting out sweltering.
yeah, and British Columbia, of course, just went through huge heat wave. Unbelievable temperatures for them. I think it was 47 Celsius, which is way too hot for anybody, I think. So we're lucky. Toronto missed that much, but it is pretty warm today. So I've got my AC going in the background, so I'm pretty comfortable. I even got the jacket on. That's cool enough to wear the coat. So for the three folks, you can see each other. Amanda is local from Toronto, like me, and we're pleased to welcome you virtually into the city today and our cafe. So I'm going to start out by just introducing you, and then I'll ask each of you to just describe a little bit about what you're doing currently, and then we'll get into some specific kind of questions. And I'm specifically interested in, from the Spanish standpoint, what you do in terms of crisis intervention and things like we saw in Florida, right? The condo collapsed. So I'm just wondering how that works with you guys. Like, are you on standby for any crisis? I'll kind of ask it that way, right? And then, what kicks in, and then how data impacts that. And, we'll get in the whole conversation. And then Amanda, we can talk maybe a little locally in that regard and how data is using and how it impacts the health system. Mm-hmm. And we should probably talk a bit about privacy as well for both of you, like from the Red Cross standpoint and also from our government kind of healthcare system standpoint, because Amanda also has a background in hospitals. And we'll see where it goes. We'll see what kind of questions we might get from our attendees and just roll through till about 1 o'clock. Sound good?
Sounds good.
Good. All right. Very good.
You were saying in terms of health system impacts, are you talking like public health or hospitals or?
Well, you could decide. I don't want you to get into any trouble with your public health folks in terms of representing public health, but you could keep it to healthcare in general and maybe focus on the difference with a public body, like a government body. And I guess hospitals are still government, though, aren't they? I mean, they're funded.
Yeah, in a sense. I was hoping to talk about that a little bit in general about the thing that public health and hospitals have in common is they are managed separately and independently and privately with their own boards. So even though they are bodies of the government needs a way to exert influence and control over what these organizations do. And so part of that is data. Yeah.
Okay, that sounds great. Yeah. And we'll just see how it rolls out. Usually we just get talking and away we go, right? So how is the COVID situation going on in Spain? We're doing pretty well over here. With vaccinations and so on. Would you say you're in the clear yet?
Not really. But we are improving. But the thing is that with the summer, a lot of young people go out and party. So it's getting a little...
out of control?
Yes.
Slightly.
Well, Ontario's been pretty conservative about opening things up. Whereas in the United States now, I mean, there's, full stadiums of people and they've dropped wearing their masks and stuff. And I haven't heard if, actually I did hear, the states where the vaccinations aren't as high I've seen an uptick. But the states with lots of vaccinations, it seems pretty good. But we're not anywhere near that. We just opened stores recently with a limited capacity. So yeah, it's a long time, isn't it?
Yes.
We had go ahead.
We still need to wear a mask. So I have heard that in some countries, once you are vaccinated, you don't need the mask anymore, at least on a site. But here it's not the case yet. So we still need to wear our masks and what Raquel was saying before, with the summer and the warm, everything is a bit out of control.
Yeah, it's hard. It's really hard to resist the temptation. We're supposed to wear masks as well, A compliment to Amanda's health unit, by the way. We got our second vaccination at a pop-up clinic, which is literally right outside our complex at a public school. So it's really close. We thought our second dose was scheduled like late in July, and we got our first dose in April. So we thought since we could get a second dose earlier, we decided we'd take advantage of it. It's like literally right next door. So we got up like at 7:30 to go outside. It started at 8 o'clock, and the lineup was already well past Victoria Park, like way up the street. It was about a mile and a half by the time we got our position. So 4.5 hours later, we got our shot. So I had to go, literally downstairs, but walk a mile and wait 4.5 hours to get it. But the compliments come in the way it was organized. I mean, they had people coming up and down the line, passing out water. They gave us our tags, which gave us a number. And, the efficiency of it was really great. And finally you get to a tent and you get your shot, and then you have a little waiting period. And, it was all computerized. So we got our receipt through our email. And it just really, really worked well. I kind of felt like special events put on the clinic because it ran so well. It was just so well organized. And what was really interesting, I think, for us, my wife and I, was the fact that it was very social, right? We've been under quarantine and whatever for the last several months, and here was a chance to see real people. There was like laughter and chatter, and it was kind of like waiting for a concert to start. At least that's how I felt. And one of the people along the line on their driveway, they brought out chairs so that as people passed their particular house, you could sit in the chairs, right? I thought it was really nice. So I had nothing but good things to say about the organization of that thing. I mean, it was a long wait, but still, we're glad we did it. And I think because it was so well organized, I mean, you can't get too upset about that. I don't think so. It was really well done. So would the Red Cross have had anything to do with clinics, or would it have been just your public health people?
The public health people, but in some communities, there has been people from the Red Cross providing vaccines as well. It depends on the community and the agreements that have at local level. But yes, in some communities we have been providing help, and in others it has not. We don't have clinics. There are maybe a small amount, but very, very small. But we don't have clinics in Spain anymore because most of the clinics that we used to have are in the public health right now. But what we do have is emergency health clinics to be able to be deployed internationally.
Ah, interesting. Yeah. Because I know in the States, they really went to town with who could give a vaccine. Even veterinarians could.
Oh, really?
Yeah. And I thought, if I had my choice, I'd love to have gone to my vet. Because it's just so amusing to me. I went to the vet and got my shots. But here pharmacies could. And of course, public health was involved. Am I forgetting anybody, Amanda, that was also giving shots? Doctors, obviously.
Yeah, hospitals were a major component. They were vaccinating even before we had our city-run clinic. So. Yeah.
So it was pretty good. It was easy enough to get the vaccines, especially over the last couple of months. Like they really got a big supply, and things started to move a lot faster. Like we got our first one in April, as I said, and then July 27th, I think we were scheduled. So we're way ahead of that because it was 2 weeks ago now already. So they opened things up, and that's good. So I think the prognosis is pretty good. I think if everybody just cooperates still and doesn't get a little crazy, maybe we can get out of the woods. I think there's a tendency too for the summer with outside. You're right that people maybe get together, but also I think the virus itself, because people are outside more, has less tendency, I guess, to take hold, although it can still happen, I guess. But it's different when it's in winter, right? And all the windows are closed and stuff. At least that's what I hear. So if we can, survive the summer and not see infections rise too much, I think we'll be okay. I sure hope so. And then we can look after all the other issues, right? So it's going to be interesting. Yeah, no kidding, right? Actually, that was a question I was going to ask of Raquel and Cecilia. When a crisis hits, is it all hands on deck, same thing, where you can't take any time off and everybody is, whatever it takes? Or is it less less like that? I mean, do you have enough people?
Last in, last out? No. No,
It all depends. Yeah, it all depends on the area you are working on. For me, it's easier to be off, but for instance, for Raquel, it's more complicated to leave. So it all depends.
Yeah, and I, from a data standpoint, I know with public health, obviously data was really significant here. And it would be the same. Would it be in any crisis? Are you constantly looking at your data through the crisis, or is it more after the fact?
It depends. During COVID, as it was a really long period of time, the emergency was not just 1 week. I mean, that maybe you get data and then once you end the intervention, you check the data. When you have a longer term, you need to check the data because you have to be accountable with the activities that you are doing and the people that you are helping. So for us, it's important that during the crisis, we also have people updating the data and being able to communicate it. In fact, in December, we have in January this year, we have a huge storm, and I was on holidays, but one of my colleagues from the information management team, she took over all the data that was needed.
Wow. Okay, we're actually right at 12:15, so stand by.